everybody. This is a very special cat named Alicat, and she's 15 years old, and she was diagnosed with intestinal lymphoma about a year and a half ago. And she's been doing great, and I don't know if you can see her coat, how good it is. It's nice and shiny, it doesn't clump, it's not damp. Her weight is almost always 10.6. Except for at the beginning of the pandemic when I didn't see her for 3 months and then she lost a pound. So, but anyway, if we just maintain these monthly visits, she seems to be, knock on wood, doing well. She's on a homemade diet, and she's on mushrooms and other herbs for immune system strength. So she's doing pretty well. Let's see. The thing that's interesting about her is she has a really long history of inflammatory bowel disease. So she had food allergies, and as we know, when they're reactive, when they have intestinal reactions, the inflammation in the intestinal tract can give rise to cancer cells. So, and we know that 70% of the body's immunity is controlled through the intestines. So having the intestines healthy is really important. So right now I'm doing a NATE treatment for amino acids, and I'm doing acupuncture points in the large intestine, in the liver, and in the spleen meridians to keep her digestion strong. In addition, we also do vitamin B12 shots, but we only do all these treatments really once a month right now. So do you have anything to add, Miss Allie? Do you have, no, nothing? She says, I'm going to shift my elbow. You can see large intestine 4, and they like to tuck that foot. But anyway, yeah, thanks for joining me with Alicat.
So Alicat went for another 2 years, 2.5 years, and she's still alive. And this is, she's still doing well. She's lost a little bit of weight, but this is, let's see, May of 2022, and I started treating her 4 years ago. So what happened was her lymphoma never recurred. Her inflammatory bowel disease was controlled with what we're doing with herbs and holistic medicine. And then she went into kidney disease, and now she's in the neighborhood of 18 or 19 years old. So then what we did was I put her on a custom herbal formula that we make for kidney disease and some other herbs, and her creatinine went from 4.1 to 2.5. And in the next slide, I will show you her new blood work. And if you scroll into it, if you look into it, the creatinine, which is a very kidney-specific enzyme, has actually reduced, which is almost unheard of in the world of elderly feline cats. Usually it just goes up and up. We did also start her on fluids, but we did that before, and she seemed to respond the most to the fluids and the herbs and the acupuncture. So anyway, a little bit more information for you.
Hi everyone again, we're back with Alicat. It's been 5 or 10 minutes with the needles. I just want you to see that she's got large intestine 4 in, let me see if I can, large intestine 11 in, but it doesn't bother her. You guys see that? Needle in the foot? She thinks it's normal. This is what she thinks is normal. I just looked back at her chart, and it looks like she was on CD food before, and we were able to manage her crystals in her urine with just a homemade diet, which was just, at first it was bison until she got allergic to it, and vegetables, no carbohydrates because of the cancer. Initially she was allergic to chicken and egg, and then that expanded out a little bit. That's why we're doing these protein clearings. Try to make it so she's not as reactive to proteins of different types. She initially had bloody diarrhea and vomiting, so she doesn't have any digestive symptoms anymore, and she's gained weight. So she's really doing well. So I'm gonna go ahead and take out her needles and then do her B12 shot, and then we'll be done with the appointment. So we'll take off her proteins. So wouldn't it be cool to go to a vet and have this experience? If you want to, sort of advocate for holistic veterinary medicine for yourself, I'll just show you. So this is large intestine 4. She just totally does not care. You could contact your veterinary school and ask them to teach the students some holistic veterinary medicine while they're still students. So they don't have to go to specialized, expensive other training to learn to do something that really would be best taught in vet school anyway, a little bit of it. So anyway, I'm going to go ahead and do her kidney points with the B12, which is just behind the last rib, and it's so good for the kidneys to do this. Just do half a cc on one side, half a cc on the other side. Oh, here's my other pet peeve. See this needle? This is a 30 gauge needle, 30. So we don't even know about it. We don't even mind it. We can do any injections with it. But most veterinarians use a larger needle. So I advocate for everyone to ask their veterinarian to use a tiny small needle. This is a 30 gauge needle. I buy it from Airtight. And I'm just gonna go ahead and, so she doesn't notice her injections. It's like so good, rather than having them worry about their injections. I guess maybe I'll show you what a 25 needle looks like. This is the average needle that most vets use. It's not their fault. They just don't know that you can do something different. And this is my needle. Can you guys see that difference? This is a 30. This is a 25. This one hurts more. This one doesn't, we don't feel. So yay, even if we can just go ask for that, then my day is worth it. Okay, take care. Bye.